Welcome to IMCAS TV, 10 Minutes with Rhinoplasty and Dr. Rick Davis. Thank you for coming. Dr. Davis, you are the medical director of the Center for Facial Restoration in Florida, and you serve on the board of directors for the American Academy of Facial Plastic and Reconstructive Surgery. I'm so happy that you're here to talk about rhinoplasty. Actually, I believe the first rhinoplasty was done in France. I'm sorry, 100 years ago. Perfected, however, in the United States. And I hope we can eventually talk about without having a diplomatic incident, if there is a difference between the French touch, the American touch, and the refinements of rhinoplasty, new techniques. So we have a whole slew of things to talk about. But the first question I have for you is rhinoplasty the master treatment for the nose, or can fillers do the same thing?
Thank you for having me. Fillers are definitely an adjunct in rhinoplasty. I don't think they will ever replace surgery as the ultimate means of sculpting a nose. We have a lot of new innovations in rhinoplasty, and fillers have a role, particularly in the management of the postoperative patient who maybe has a minor nuance, contour abnormality.
So it's really for refining, for the
Correct.
nuances.
In my opinion, it would not be a suitable substitute for a surgical procedure. Rhinoplasty is mostly a skeletal operation, and the only role that filler has is camouflage. And generally, we're making noses smaller. We're trying to refine the nasal contour, and so there isn't really any way a filler can do that.
And they're not permanent.
And fillers, well, there are permanent fillers, but the safety and the efficacy of that long term is questionable.
It's debatable.
And then the ones that are currently available that are renewable would mean a lifetime of, and frankly, every time you'd go to the doctor to have your filler, your nose will look a little different than the time before. So.
Exactly. What are the refinements of rhinoplasty and the new techniques? We were talking earlier about computer imaging, and if you can develop that.
There are several large innovations that have changed the face of rhinoplasty in the last 30 years. And then there are smaller things that are pushing it forward. I think we're entering a new age in rhinoplasty. This is an era of surgical precision, reliability, and the best results we've ever known in this surgical niche. But the advent of structural rhinoplasty, the concept that the nose is an appendage that has to be durable and has to have a longevity, gets back to the fact that the skeletal components, although we're changing them, have to remain strong. And so the thinking in rhinoplasty over the past 25 years is evolving into remove less tissue, try to rearrange or reconfigure the tissue that's there, and maintain the structural integrity of the nose. So that's been a milestone in terms of the thinking and the improvement in the quality of rhinoplasty. Instruments are becoming far more sophisticated, and before we tended to gravitate toward a hammer and a chisel, and it was very primitive and crude. The advent of electronic equipment, saws and drills and rasps and power tools that are far more precise and far more gentle than traditional methods.
Surgical.
Far more surgical, exactly. These items have really brought finesse to an operation that demands finesse. And the computer, in terms of being able to image a patient in your office, display the picture in front of your patient, alter the picture with their input to derive a surgical objective, a cosmetic goal, that gives the patient something tangible that they can look at and say, yes, that's what I'm after.
No surprises.
Or perhaps they say, no, that's not what I'm after. Try, and so we can get their input.
So that helps the dialogue between patient and doctor.
Absolutely. And the tool is a great communication tool for the dialogue, as you say, but it also gives the surgeon something to aim at. I have now also a concrete
guideline.
image that I can not only show the patient, but I can also use that to plan and blueprint my operation. So the computer, in my opinion, is one of the most powerful innovations in the past 15 years that has come to this surgical specialty.
And your patients, they come to you and say, I want this. Is there a trend you're seeing in rhinoplasty now?
There's absolutely a trend, but it's a broad and general trend, and that is I don't want to look like you operated on my nose. I want to have an entirely natural look. I want it to flatter my face, okay? And what they're really saying is when I walk in the room, I don't want someone to notice my nose before they notice me. I want them to notice my eyes and my smile and identify me as a person rather than as that person with the big nose.
With the big nose. Without changing their face. Sometimes a nose changes a personality also.
It's very true, and part of the artistry of rhinoplasty is to be able to harmonize your end result with the patient's ethnicity, with their gender, with their bone structure. So there's a technical aspect of rhinoplasty, which is how do I get to the end result, but there's an artistry that determines what the end result should be,
right,
and how that nose kind of interdigitates with the surrounding face.
And the evolution of techniques we were talking about, is there a different evolution in the United States than you're seeing here in Europe with your colleagues?
Information sharing has mushroomed in rhinoplasty. Between the internet and the growing number of meetings and conferences that we hold, I see my international colleagues several times throughout the year, and we're teaching one another. So there seems to be a convergence of thinking, whereas previously we might have been isolated and heading in different directions. Now we're taking the best ideas from one another, and we're really becoming a single global entity.
Collaboration.
Exactly, where my partner, or my colleagues in Asia, my colleagues in Europe, my colleagues in South America are all helping me become a better surgeon.
And I want to go back to structural rhinoplasty. Is this the best way to get results over time, in your opinion?
Structural rhinoplasty takes time. It's a longer operation. It's a bit more invasive than the traditional method, but its major benefit is that you have control over the long-term shape of the nose. So there's fewer surprises at a year, at 5 years, at 10 years. We as surgeons tend to forget that the nose is changing anyway.
Yeah.
Over the course of the human life cycle, the nose will look a lot different at 80 than it does at 15.
And patients forget too.
Exactly. And with traditional methods that removed a lot of tissue, we found ourselves seeing the nose age prematurely. So that aging cycle was accelerated. By reinforcing the nose structurally, by putting tissue back into the nose as we beautify it, we lock it into shape. And I always tell my patients that when they're 85 and in the nursing home, they'll have the best looking nose in the house.
Well, on that note, thank you very, very much for joining us.
Thank you, Pamela. It's been a pleasure.